Through their associations, truck drivers have embarked on sensitizing colleagues on the importance of getting vaccinated against COVID-19. This campaign is in line with a government call for the private sector to play a central role in changing the perception of the public towards vaccination.
Get a truck driver to talk to a fellow truck driver about anything, they are bound to listen to it more when you get a smartly dressed doctor going to truck drivers to talk about the same thing. Get vaccinated, you lose manpower. I am a fellow truck driver, I'm vaccinated. It is not true that when you vaccinate, you die. So this was very important for the fellow community members to go to their fellow drivers.
With the support from the Private Sector Foundation in Uganda, different vaccination points have been erected on border points and terminal parking grounds for trucks to enforce the vaccination exercise.
So when do a driver watch TV or listen to a radio? And even if they listen to a radio, they are in Sudan, they are in areas where the frequency is not good. So we decided to reach them out in areas where they park or their stopovers, so that we add on and emphasize that drivers should observe the standard operation procedures.
We have a fellow truck driver and we have a fellow commercial sex worker who is able to convince the peers and to always follow them up. So this is what we call the community-led approach. Because the drivers were asking so many questions, they were not willing to take the jabs.
Truck drivers are questioning the relevance of continuing to pay for testing despite finishing the vaccination with the 2 jabs. They appeal to the government to reconsider that condition on border points.
Decided to encourage our drivers to test, so that maybe government, with the time, with the East African community, they can allow drivers to move freely, provided they have tested, provided they have vaccinated for COVID, than every 14 days when they are spending money for the tests.
Afrika Mashariki yote tutambulike, ili tusiweze kulipa kila boda tunalipa $50. Kwa hiyo hizi document zinaonyesha kwamba hapa nimetoka, hapa ni Uganda na hii hapa ni Malawi, yote nalipa $50.
After 14 days we have to pay that money. Now the question is, we are going to be continuing paying that money after 14 days, whatever I have this certificate. That is my question.
This community-led approach of vaccination is projected to enable Uganda to meet the target of at least 4.8 million people vaccinated